So you've just finished your radiation simulation, and you're probably wondering, what happens now? Well, in this explainer, we're going to pull back the curtain and show you the incredible behind-the-scenes process of creating your personal treatment plan. Right, so you've done your part. You've been scanned and marked. And now, you wait. It can feel a little strange, this quiet period. What is actually going on behind the scenes? That is exactly what we are going to dive into right now.
First things first, let's talk about time. This whole planning phase usually takes somewhere between 1 and 7 days. Now, of course, simpler plans can be quicker, and the really complex ones might take a little bit longer, but that gives you a pretty good ballpark.
And here's the most important thing to know. During this time, you're not receiving any radiation, not a single beam. This period is 100% dedicated to meticulous precision planning. It's all about making sure your treatment is perfectly tailored to you. And who's doing all this work? Well, it's not just one person in a dark room. It's an entire team of experts. You've got your radiation oncologist, a dosimetrist, a medical physicist, and your radiation therapists all working together, collaborating on your specific plan. It's a real team effort. Okay, so let's start our behind-the-scenes tour. The very first step is creating what we call your digital blueprint. This is where your team turns all those scans into a personalized three-dimensional model of you. The process starts by gathering all the pieces of your personal puzzle. They import your CT scans from the simulation. If you had an MRI or a PET scan, those get layered in too. They even include the photos and notes your therapist took, all to make sure your position is exactly the same every single day of treatment. Next up is a super critical step called contouring, and you can think of this like digital sculpting. Your radiation oncologist literally draws on these 3D scans, carefully outlining the exact areas that need treatment, those are the targets, and just as importantly, they map out the healthy tissues nearby that need to be protected.
Now, how they do this can vary a little. With a modern CT simulation, the doctor draws right on those super detailed 3D images. In other cases, for what's called a clinical simulation, the team might use X-rays and physical landmarks to define the treatment zone. Either way, the goal is always the same: absolute precision.
All right, once that digital map is created, we move into the next big phase, designing the perfect dose. This is really where the art and science of this whole process come together to create a plan that is truly 100% yours. This is where a specialist called a dosimetrist steps in. Using incredibly powerful software, they become the architect of your plan. They figure out the best angles for the radiation beams to enter your body. They use these tiny computer-controlled leaves to shape every single beam to match the tumor perfectly, and they choose the best delivery technique. The whole time, the computer is running thousands of calculations to maximize the dose to the target while keeping healthy tissue safe. But it doesn't stop there. Once the dosimetrist has a great plan, it goes right back to your radiation oncologist. They then go over every single detail with a fine-tooth comb, making sure it meets their exact specifications. During this final review, the doctor is checking a few key things. They're confirming the dose to the target is powerful enough. They're verifying that the dose to all your healthy organs is well within safe limits. And only when everything is perfect do they sign off on the final prescription, locking in the plan. But believe it or not, we are still not done. Before a single beam of radiation is ever turned on, that plan has to run through a whole gauntlet of safety checks. This part is all about triple and quadruple checking that everything is precise, accurate, and above all, safe. So a medical physicist, who is an independent expert, comes in to do their own review. They double-check every calculation in the plan. And for many plans, they'll actually test it out first on a device called a phantom, which mimics the human body. They want to prove, without a doubt, that the machine can deliver your plan exactly as it was designed. On top of that, there's a full chart check. This might sound like paperwork, but it's so important. It's where someone ensures every document, every doctor's order, and every instruction in your file is totally complete and consistent. No stone is left unturned. And as if that wasn't enough, many centers add yet another layer of safety: peer review. This is where a group of radiation oncologists will get together and review complex plans as a team, bringing even more expertise to your care. This quote really says it all, doesn't it? The whole point of this entire multi-step process is to have multiple experts confirm that the right dose goes to exactly the right place, and only there. Okay, so while all of that is happening in the background, you might be wondering, what's my role in all this? Well, let's talk about the small but important part you play while you're waiting. Honestly, for the most part, your job is to just relax and wait for our call. But do keep your phone handy just in case the team needs to ask you something. If you were told to practice a bladder or bowel routine, please keep doing it. It makes a huge difference. And most importantly, please call us if anything changes. New pain, you have a dentist appointment, you have to travel unexpectedly, let us know. And then, once your plan has passed every single check with flying colors, you'll get that call. Your start date is officially scheduled, and your personalized plan gets loaded directly onto the treatment machine, where it's ready and waiting for your first day. Now, you might have a few what-if questions, right? Like, what if you're getting a really focused treatment like SBRT? Well, those plans get even more imaging and QA steps. What if your body changes during treatment? No problem. The team can rescan and adapt your plan on the fly. And for things like brachytherapy, it's a very similar planning process, just tailored for internal radiation. So, I hope you see that this entire complex, expert-driven process, it's all designed for one single purpose: to guarantee your safety and to deliver the absolute most effective treatment possible. So all of that quiet work, all those checks and balances, it all leads to this, a precise, powerful plan made just for you. So when you walk into that first treatment, you can feel confident knowing exactly what went into it. The goal is set, the plan is ready. Are you ready for day one?